Well, welcome in to the EKG Beach Party officially. We are now live in the 3-day EKG group. Now, what is today? Today is basically a little bit of a recap of what we spent the last 2 weeks doing together. And then it's a little bit of let's test our knowledge. And then we're going to go through the 10-step system of how to read an EKG. And then we'll wrap up the encore presentation of the EKG Beach Party. So let me make sure that we are streaming on Facebook. So excellent. All right. See, we have some people hopping on. Hello, Matt. Hello, Andrea. Welcome in. You guys, I'm so excited to share what I put together today for you. So without any further ado, let's get started. So this is our encore presentation of the EKG Beach Party. And in case this is your first time hopping on, just to go back in time, I'm going to really quickly just review who I am in case this is your first time meeting me. Hello. Actually, I've changed that. It's now 17 years as a PA, working in both cardiology and emergency medicine, although I have not worked in the ER now for a little while. And it's crazy. I miss it. But now just doing inpatient cardiology only. Formerly, I was a paramedic of 13 years, some of the best years of my life. I love that job. And I've trained at UC Davis FNP program back in the day, and I've written numerous urgent care journals, articles. There's one coming out soon, probably next week, on an interesting case. I'll post it when it publishes. And then I lecture at PA and MP conferences. So on that note, I'm actually going to speak in Boston for NPACE, if you guys want to come out and hang out. And that'll be in August. And then I'm doing a new Myrtle Beach and doing my hands-on EKG workshop the only time this year in Myrtle Beach. So there's a couple spots left in that workshop. If you do want to see it live, I highly recommend going on and grabbing a spot. I believe that Matt Holden is going to be joining me, and his beautiful wife, Shania, who is going to teach a hemodynamics class for us in our 30-day EKG challenge this week. So that's going to be super fun. And then I'm going to be speaking in October in one of our PA conferences, cardiology PA conferences, and it's going to be at the Red Rock, I believe. It's going to be amazing. So if any of you want to join any of those, I would love to meet you in person. So I'll be out there on the road, just limited this year, but would definitely like to see you if possible. So let's recap what we covered. We covered on night 1 some fundamentals and some anatomy. So we took the big heart and we showed you inside what's going on, how does it correspond? And by the way, if any of you want to go back and watch any of those sessions, they're on a specified replay page that everything's all in one to make it super easy. This will go on there as well. And all of the recordings, night 1 through 4, plus our bonus tonight, will all be up on that replay page until at least the end of the week, for you to watch if you want to binge watch those if you haven't seen them yet. And then if you want to have continued access to all these recordings after that, they'll be stored in our 30-day EKG challenge that we're going to be starting tomorrow. And you'll have lifetime access to these recordings if you join our 30-day EKG challenge. We'll tell you a little bit more about at the end of the night. Now, night 2, we did arrhythmia practice, which was fun. And then night 3, we did basic 12 lead. And we had a guest on, if you remember, she was a patient who has HCM, hypertrophic cardiomyopathy, and a device. And she talked about her life. She talks about symptoms she had that were ignored for a long time, and how we could be more aware and have that disease process on our radar, which was really exciting to talk to her, Hannah. And then night 4, we did some really fun stuff that was all voted on by you guys. Bundle branches, we did basically a little intro to bundle branches. We did some cases to solve, and the people who showed up did a great job. It was really fun having you guys in the chat, talking to each other. So those are still up. Feel free to go back and watch those if you want. But tonight, we're going to do just a little recap. I'm going to do like 4 or 5 slides of recap, and then we're going to jump into new stuff. So first things first, night 1, we talked about some terminology and fundamentals. So contiguous leads, what are they? Contiguous are leads that are fed by the same artery. Now, that would be, for example, lead V1, 2, 3, and 4, right? They're all fed by the left anterior descending. And then we also need to understand that term reciprocal, which means the opposite of. So if you have ST elevation on one part of the heart, you're going to have depression somewhere else, which is the opposite wall. And we talked about that you need that to have STEMI. Otherwise, it's not a STEMI, right? You have to have reciprocal changes unless you're dealing with, for example, V2 and V3. That's a little different story. And then ectopy, we talked about that those are extra beats. You can have PACs, PVCs, and knowing how to identify them is important for documentation. And also, one is fairly benign and one is a little more dangerous. The PVCs are more dangerous. So knowing how to identify those. We talked about a place on the EKG called the isoelectric line where you could go and basically look to see the flattest part of the EKG, so you'd know where to line up to see if you have ST elevation or depression. We also talked about the fact that you should have a clean EKG, no artifact. We talked about the voltage, size of the R wave matters, and if you have a low voltage, we worry about pericardial effusion or serious things like that. And then we talked about STEMI, that's easy, ST elevation, MI. So we also talked about how the EKG can tell you the size of the ventricle. So for example, if you have a very big R wave, usually that means a big ventricle. You can also see with the size of the P wave and if it's notched or not, if they have enlarged atrium. You can also tell by the size of the T wave, if it's pointy, that you have hyperkalemia, right? And then you can also see the opposite of that by a T wave that's very small or flat. Now we can also see if there's fluid around the heart, that is pericardial effusion, and that would make our voltage really small, so small R waves. And we use the conduction system to basically see who's running the heart. So we're always looking for a P wave. So that's a lot of information on a flat piece of paper. So my question to you is, what have you tried before to learn EKGs? And I'm pretty willing to guess that, oh, hey, Christy. Christy and I just met. We got to hang out. She got a tutoring session along with her 30-day EKG challenge purchase, and we got to meet and we had a blast. That one-on-one time I really appreciated that. Loved chatting with you and getting you ready for all the things. So what have you tried before to learn EKGs? So I'm pretty willing to say a lot of you have done books because that's how they taught us in school. Maybe you've watched some videos, maybe you've taken other classes, but why are you still uncomfortable with EKGs? Why did you not get confident yet? So, and you don't have to put it in the chat, you can if you want to, but I want you to ask yourself that because really, that's going to help you identify what you need to get better, right? So, for me, it was the Orange book, the Dubin's book, and I will tell you that a lot of people love that book. But for me, it didn't work. I felt like an idiot, right? Hey, KJ. So I needed it to be taught a different way. I'm a very visual learner. I need to be shown. I need to draw. I need to interact with something to really learn it. And that Dubin's just didn't make sense to me. It also taught us, like, I think the first part was like axis or vectors. And that's really not the way, in my opinion, that you should teach EKGs. I think that, and so I created this whole course, 30-day EKG challenge, so we could basically turn that on its head and be like, no, we're going to actually show you the way I wish I would have someone should have showed me. Like, let's go through, like, how do you talk about an EKG? What are the terms? What are the waves? What are the segments? What's the, proper way to say something? And then moving on that and going through arrhythmias, moving into basic 12 lead, right? And so not coming at someone with axis when, to be honest, axis isn't widely used for much, although people are really afraid of it. So there's a lot of intimidation around bundle branch blocks and axis when there really shouldn't be. We kind of take the fear out of that. But basically just asking yourself, what have you tried and what do you need to get to the point where you don't feel uncomfortable when someone hands you an EKG anymore? What is that thing? And once you figure out what that is, go get it. Because here's the thing. I was just telling one of our students this. I was like, there's like at least 5 to 6 things that the machine will never pick up that could kill a patient if you miss it, if you're the last person to see that EKG. And that's where I think that, and I mentioned this earlier in the challenge, that like, that's where if I was like, hey, give me an hour with you, and I want to make you safe in an hour, what would I do? Well, I would show you 2-to-1 atrial flutter. I would make sure you knew that because that could kill someone if you miss it. It looks just like sinus tach. And if you don't anticoagulate somebody, you could die. They could die and you lose your license and your career's done, right? I would teach you that. And I would teach you the 5 things that could kill somebody and that would say non-specific ST2 wave changes, the 5 patterns. And then I would teach you the STEMI equivalents that are new, that nobody knows about. And that's what I would spend my time on with you for an hour. And I'd make sure you understood those, and I would give you homework on that, right? So you don't have, honestly, a bad outcome for you or for the patient. That's what I would spend my time on if I had you for just an hour. Obviously, I want you for longer than that to teach you more things, but really when you triage like what you need to know, that's the things that are going to bite you, right? If you miss a PVC, it's not the end of the world. No one's going to die from that. But if you miss a D Winters or you miss a hyperacute T wave, people are going to die, right? And that's bad. So anyway, I decided to put together a couple practice things. Some of them are easy. Some of them are a little bit more not easy. And then we're going to jump into the 12 or the 10-step system to read 12 leads so that we can go through one EKG using all the steps so you can see how that works if you don't already have one. But let's just see on this EKG, let's just do something easy. So first of all, let's just talk about really quickly how to orient yourself to what's going on here. Okay, so what you've got is down here, you've got a rhythm strip. Okay, so rhythm strip here. And then these are your 12 leads. This is where you're going to be making your decision on what's going on. So this, we don't have any numbers up here like we normally would. I took those off on purpose because I wanted to see if you guys could tell me just by sight, by pattern recognition. Can anybody type in the chat? Is this too fast or too slow? Either one of those. Too fast or too slow? What do you guys think? Yes, good job, Andrea and Dana and Matt. Everybody's like, this is too Brady. Good. The heart rate was actually 41, so you're all right. And at the end of the day, we have to make a decision. What is the rhythm? So how are we going to do that? Well, what we're going to do is we're going to go and we're going to see 2 things. Do I have a P wave? I do. Does the P wave come at the same time each time with the QRS? Yes. Okay. And then lastly, well, actually, there's 2 more things. I need to know, is the R to R regular? Yes. Okay, good. And the width of the QRS starts to widen out a little bit, but it's probably not yet 120. But basically, that helps me decide what my rhythm is. So what do you guys think? What do you all think the rhythm is? We have to call it something. So it would be called a sinus Brady. Crystal, yes, good job, Crystal. It is sinus Brady, and that was easy. Now, for the harder part, what would you ask this patient? Oh, hey, Crystal, or hey, Cheryl. What would you ask? Yes, Crystal is. What would you ask the patient if they had a heart rate of 41 like they do here? What would you ask them? Yes, Amanda, how are you feeling? Exactly. And what if they said, I feel fine? What's like the next question you'd ask them? Yes, Dana, what meds do they take? Probably some beta blocker in there. What were you doing when it happened? Any chest pain? These are all good. Are you sure? Family history, these are all good. Patient says, no. I feel fine. I'm not lightheaded. Nope, no fatigue, no chest pain. I feel great. I feel so good. Vitals are otherwise, blood pressure's fine. So what's the next question you would ask? Like, because you've kind of ruled out all the other things. So is this normal for you? I love it. Oh, there's 2 Danas. Nice. Dana Alsop and one other Dana. So, and also Dana, did you get into the 30-day EKG group? Because I know you joined us. Did you get into the Facebook group? Because we need to make sure you're in it. But the thing I would ask this guy is, are you athletic? If so, tell me about what you do for activity. If this guy rides 20 miles a day, his heart rate is fine, right? And so this just fine tuning. But anyway, I love going through this stuff with you guys. So much fun. All right, what is that funky beat there? What is that funky beat? What is this one called? We're just talking about this, right? Talking about funky beats. Yeah, good job, Crystal and Andrea, Amanda. Yes, PVCs. Good job, you guys. These are PVCs. How did you know? What told you they were a PVC? Good job. Hey, Komal, what's happening? How did you know? Because they're wide, right? They're early and they're wide. Good, Orit. Hey, Orit, what's up? So happy to see you here. Okay, and wide. Perfect. So it comes early and it's wide. Good job, you guys. Good job. That was pretty easy, right? These are easy. But let me put a little bit more steam in the game. Skin in the game, not steam in the game. Okay, so which one of these is right? Okay, number one, those are elevated T waves, talking about these T waves. The T waves are depressed over here. The patient's ST segment is elevated. What would you say is the right one? What do you guys think? Because it's important to know how to talk about the EKG, right? And I'm going to make a bold statement in a minute, but I would honestly say, oh, KJ already knows. KJ already took out one of them for you. Hey, Erica, how are you? A long time no see. I miss you, girl. So anyway, going back to this, as KJ said, KJ took out one of them. The T waves are depressed because T waves will never be depressed. Okay, they will only be inverted, or they'll be biphasic, they'll be upright or inverted, but they will not be depressed. If they're upside down, they're not depressed. Hi, Orid. And then, so that leaves us two. Those are these T waves elevated? Is that the proper terminology? Or the patient's ST segment is elevated? What is more proper? So the more proper is the patient's ST segment is elevated, and I'm going to show you why. Yes, good job, you guys. Good job. So here it is. This ST segment is a little elevated. Okay, so the T waves, the elevated T waves, we don't really have elevated T waves. We'll have big T waves or hyperacute, or large T waves, but we limit elevation for talking about ST segments. So it's just important to really be able to know the way to talk about it so that you don't seem like you don't know what you're talking about, right? It's just, that's why EKG terminology is really important. I know people are like, why do you cover that? Because the last thing you want to do is walk into wherever you're working and say the wrong lingo, because instantly your credibility is out the window. And we don't want that for you. Okay. All right. Let's talk about this. I'm going to put my speaker on. I just realized I didn't. Is this a STEMI? Is this a STEMI? Call the fire department because Crystal's on fire. I like that. Oh my gosh, you make me laugh every night, literally. Okay, so there's a couple things you need to know. There is some ST elevation, but we don't really have any. It didn't get called a STEMI. Let me go back. This didn't get called a STEMI because we need to have two small boxes, and usually two small boxes, and it depends on the age and sex. Okay, but what you're always going to do is you're going to go across and you're going to look for, you're going to draw your lines. I know KJ's probably writing that right now for me. And you're going to look at all of them, right? To see if there's any ST elevation or depression. You're going to go through all of them. But at the end of the day, so here's the thing, where this becomes tricky. And we do a whole thing on this in our class, in our 30-day, but basically in V2 and V3, we have different criteria for STEMI. And it's based on age and sex. And so the other thing about V2 and V3, you'll have no reciprocal changes. So this is getting a little bit advanced. I don't want to take this too advanced, but you need to understand the numbers, right? You need to understand the numbers. And this is not a STEMI yet. It's heading that way because the patient is young. Patient is 39. So he needs to have a lot. He needs to have 2.5 millimeters of ST elevation. Okay. So when you talk about ST elevation in the other leads, you just need to have 1 millimeter of elevation with reciprocal depression to be called STEMI. Now, I just want to stop and say something really quick. I'm going to tell you that this is something that is a paradigm shift, essentially. But we're not just looking for STEMI anymore. We're also looking for something called OMI, which stands for occlusion MI. And that's where you start getting into the T wave changes that are not a STEMI, but are still telling you there's something wrong. And this is all like super fine point stuff, but this is the stuff that I'm talking about where I think there's a lot of risk that a lot of providers don't really know, right? Because, like, for example, if this patient had a biphasic T wave, that's concerning for occlusion MI, right? Hyperacute T waves are concerning for occlusion MI. So we just can't just know STEMI anymore. We have to know all the other ways the heart tells us that it's blocked. Okay. All right. So this was not yet. It's probably heading that way. We would probably be suspicious of the LAD because that's where those arteries feed. And then this is a case I put up on, I believe I put it on Instagram today. And if you don't already follow me there, I do post cases. So you might want to follow me, Cardiology Made Easy. And I put this case up because I wanted to see if anybody would pick up on it. So before I tell you the answer, this is EKG number 1. This is EKG number 2. And so the question is there a change? Hey, Julie, what's up? Is there a change? Yeah? Okay. There is, I agree. What do we call a change? Exactly, Crystal. The T wave in V6 is inverted. Dana says V5 and V6 have a problem. I would agree. Totally. So we have a change from 1 to 2. What do we call, what's the lingo for that? How do we talk about that? What do we say? We say the voltage is talking about the size of the R. What we say is there is a dynamic EKG change. Okay. You could also say ischemic changes. Yep. But dynamic EKG changes is the way to get someone's attention. Like they need to go to cath. So this patient did go to cath based on this EKG. Because what you'll learn in our 30-day EKG challenge, where we kind of deeper dive into EKGs, is that anytime a T wave is biphasic like this or inverted, that's a sign that it could be ischemia. And those are the little fine details that are going to be read by the machine as non-specific, but really this was a cath lab activation because his troponin was also elevated. And he also was having active pain at the time of this EKG. His T waves were also starting to trend up as well. They were big here, and then they started getting a little more pointy. So my question immediately when I saw this was, what's the potassium? But it was normal. So always being able to ferret out hyperkalemia versus hyperacute T waves is an important thing too. Now, practicing. Okay, so why did this patient die? This was a real patient. She had cardiac arrest. She was 51. This was her door time EKG after she got resuscitated. She's in the field, which was a great field save. Neurologically intact, which was the best news ever. But why did she die? I love asking that question of our cardiac arrest patients, like looking back, what happened and what was missed? Was anything missed? Because KJ got it. I love it, KJ. I swear you are so smart. So what's happening here is KJ said, come here, Remy. Come say hi to everybody. KJ said, hey, I'm noticing prolonged QT. He always sleeps right here when I teach with you guys. I wish I could show you. But anyway, the R to R, and then you've got if you draw the line down, if the T is almost hitting the line in the middle here, then that's prolonged QT. So yes, this patient does have prolonged QT. This was a patient who had a QT of like 512, and that is why she had cardiac arrest. Okay, so over 500, you're usually having to worry about that. Yeah, good job. So you guys are killing it over here. Can't fool you with anything. Except, and KJ, you're not allowed to answer on this one because you know the answer. I already know you know it. Hey, Kamal. Yep, right on, spot on, as usual, Kamal. Okay. So this patient has chest pain for 3 days. And you should, Remy, as part of the group. I know, Remy, you should come over here. Um, anyway, so this guy comes in. This is a real case. I know. Come here. Come say hi. Come here. No, he's too tired from playing ball. So this guy comes in with chest pain for 3 days, and he doesn't want to go to the ER. He's in your office. Won't go to the ER. So, do you guys see anything that's concerning to you? Beach. I love your name, Beach. That's cute. That's so festive for tonight. So actually, yes, there is flipped T-Waves Beach, but there is no D Winters. Dana, yes, T-Wave inversions in V5 and V6. Yep. Are you guys concerned? Like, what are you gonna do with this guy? Can he go home and can you get a stress test and follow him up? Yeah, Remy is here. I wish I could show you guys. Remy, will you just come here? Everybody wants to see you. Come here. No? He's just staring at me. What are you realistically going to do? Think about this. This patient's in your clinic. With this EKG, it does not say STEMI. Notice up here, it says ST2 wave abnormality. Is it just because of the T waves over here? So what are you really going to do? Oh, Orit. Orit is in the house to be busting some knowledge out for us. So what leads do you see hyperacute T waves? And Dana is also pointing out the upright T. I agree. You guys are on fire, as Matt said. Where are the hyperacute T's? Okay, Orit. Yes, send to the ED because of V2 and V3. Orit, you are right. And that is exactly what is going to happen. Okay, so he needs to go to the ER. He says no, but he's got too many EKG findings, right, that are bad. And literally, this guy turned into a STEMI 5 minutes later after this EKG. So if we would have not let him go to the ER, he would have died. And if we didn't spot the findings to be concerned, and we just said, oh, ST2 abnormality, I'm going to get you a stress test. So when you guys get an umbrella because it's raining correct answers here. So when you guys are thinking to yourselves, oh yeah, got the normal EKG and I know what STEMI is. I'm fine. I'm just going to use the machine for the stuff in between. That's a dangerous thing because the machine is right 6 to 42% of the time. And that was my strategy too when I first started. I was like, well, machines are smarter than me, but it can lead you astray and in the wrong way. And personally, like that's, when I think about it, I'm like, my license, I got to defend that. I got to protect my patient. That's like first and foremost. So what do I need to do that? And really that's where this comes in, is really learning these subtle non-specific things. Okay. So Dana says, question in primary care, if it's slightly abnormal, how long do you repeat an EKG? Because normally they are only there for a few minutes. That's a good thing. So I know that in primary and urgent and even cardiology, we are always in lack of rooms. The patients are there a brief amount of time. So if I have an abnormal EKG, and I have suspicion with their story, their history, the whole clinical picture, I will recommend ER. If they don't want to go, that's when I come into serial EKGs in my clinic. I don't ever want to do that because it gums up the flow of the clinic. But if your patient won't go and you're worried, then it is an in-between thing that I would do. Now I have seen, and I do show a case of this in our 30-day, where a patient STEMIed within 4 minutes. And it was a very benign first EKG, very benign. Like something was going on in ABL and that was it. And so there's no like hard fast rule for like how often to get serials, but I have seen within 4 minutes. I would say it's probably not unreasonable to do 10. Or even if the patient would agree, you could say, hey, I know you want to go, but do me a favor. Let's just to be sure, okay, let's make sure that nothing is changing. There's no dynamic EKG changes. Okay, there we are, that word. So what I'm going to do is I'm going to see my next patient. You're going to sit over here in my waiting room. When I'm done with my patient, I'm going to bring you back in. We're going to do another EKG. Or if you have, even better, keep the EKG machine on him in a room, him or her, and go see your next patient. And you can have the MA run a serial EKG while you're in there, like whatever you can work out. But there's no like hard or fast rules, and I don't really use that unless I'm worried. I'll use like serial EKGs in the hospital a lot because, especially if their troponin is kind of like flat or, maybe rising a little bit and you're just that there's still a question, right? Getting another EKG is a good way to see where things are going. It also helps you prove that they were stable at the time. So straight to the cath lab. Exactly, Kamal. Exactly. So V4 looks like Wellens. It is. Yes, exactly. So there's lots of bad things on this EKG. So let's go back to the fundamentals and do a little practice on the basic 12 lead approach that our wonderful coach, Michelle Barkley, this is her. She's drinking her coffee. She's going to tell us about the 10 steps. Okay, this is Coach Michelle. You've probably seen her in our 3-day as well. She pops in from time to time, but she's a regular coach in our 30-day. But she made this little graphic for us of big sick versus little sick and all the things. Okay. Yes, Wellens, not D-Winters. But it's not Wellens if it's not in V2 and V3. So it's like all fine point stuff. It's all fine point. But anyway, you notice there was a problem, and that's probably the bigger thing is you notice there was something bad. Okay, so the 10 steps are here, and I'm going to leave this here for you to marinate on, but basically we're going to go do it in real time with one EKG. Michelle is so visual. That's why I love her. We get along so well. This is another little thing she put together, her clock. Same type of thing, but she goes into it a little deeper. I'll leave that in the video for you here if you want to review that, but let's go in and do it. So, I just realized that collapsed. So the first thing you want to do is you want to make sure that if the patient is big sick versus little sick, okay? So they're really, really, really bad EKG, like a STEMI, like AFib with RVR, like VTAC, that's the one you're not going to do the rest of the steps on. You're going to address whatever it is, and they're going to go to the ER, right? You're not going to do these little fine point things. You're not going to be looking at all the intervals. You're not going to be looking at the ST segments. If you see a STEMI, they're going, right? So, I skipped a step. So step 2 is looking at the rate. That's easy because the rate is right here. And you can go, here's our rate. Cool. All right. Awesome sauce. It's 72. Should be between 60 and 100. 0, that's the axis. I was getting ahead of myself there. And then step 3 is rhythm. We already did this a little bit earlier. You're just going to go on down here for this long lead that's pulled out for you, and we're going to solve for X. You guys remember that in algebra? Oh my God, I hated algebra. So what you're going to do is you're going to see if there's a P. Now, this one looks funky. It's V1. I don't like V1 pulled out from my rhythm strip. I want lead 2. So I'm going to look here. Yep, I have a P wave. Yes, it's the same distance away from the QRS, right? And I can do that over here too. But this is a sinus rhythm. The machine is actually correct. I'm shocked. But the closer an EKG is to being normal, the closer it will be to getting it right on. Heart rate 0, yes, that's bad. Yeah, heart rate 0 is bad. Intervals. So there's actually some information that they don't give you on the EKG, but they give you in the lab values. So let's go through it real quick. So the heart rate, ventricular rate, should be 60 to 100. Okay, the PR should be 120 to 200. QRS should be less than 120. The QTC, less than milliseconds. And then the axis should be 0 to 90. Okay, so let's see if we're right. So if all these are, so the ventricular rate, 72 meets the bill. PR 128, yep. QRS 76, yep. QTC, oh no, let's go back to that. The 74 is the axis, that's correct. But this one here, wah, wah, no. Okay, there's the problem. We just solved for X. This is the problem. This is that same EKG, right? The lady that had the arrest. Okay, so that's kind of how you go through those intervals for step 4. Now, step 5, is also included. We just did the axis. Step 6 is looking at the ST segments, looking for any elevation or depression. I know, right, Matt? Total EKG box ninja. Yeah. And as KJ is going to tell me any minute, KJ is going to say, draw your lines, which we already did on this EKG, but basically let me show you where to draw your lines. So this is the end of the, I don't really like how thick that is. Let's go here. This is the end of the T, beginning of the P. This is the isoelectric line. This is where you always want to line up when you draw your lines to see if there's any elevation or depression. This is the isoelectric. So we didn't actually have any ST elevation or depression to be concerned about. It was actually a prolonged QT issue. I know, draw your lines, KJ. I will never, ever hear anybody else saying that, KJ. It's always going to be yours. And then we're going to come in and see if the R waves are too big or too small. We talked about earlier what that could mean, but they're not. They're okay. And then step 8, looking at the T waves. So that's where you gotta remember, okay, if you go back and you're like, okay, well, what's my T wave rules? Well, we know we need to have AVR and B1. They need to be inverted. Everyone else needs to be upright. So let's see what we have here. Well, first of all, that's not upright. And that's not upright, and it should be. And this is actually inverted. Oh, actually, no, God. So that's good. Anybody else having an issue with any of their T waves? No, but this is kind of flat. I don't know like how flat that is. But those two are not following the rules. So a lot of times that can mean ischemia. A lot of times that can mean, PE, intracranial hemorrhage. There's lots of things it could mean, but inverted T waves are something to not sneeze at. And we go into depth on that in our 30-day, but just noticing them for tonight is enough. And then also looking for significant Q waves. Let's talk about that for a second because it's important to know. So Q waves. Q waves. If you have more than 1/3 the R wave, they are pathologic. Okay, so we don't see any pathologic cues. So that's good. And then lastly, but not leastly, is the chief complaint-based approach. So if they are kind of flat, Matt, I would agree, especially in V3. Chief complaint-based approach. So if this lady was a technically syncope/cardiac arrest, so we would need to look for specific things. Like we would need to look for prolonged QT, that's actually on the list. We would need to look for Brugada, HCM. We would need to look for ACS, of course, and a short PR. It's kind of my list that I go through and I document the presence or absence thereof because it's really important that you don't miss any of those things on a syncope patient or cardiac arrest. So there's other things too. That's just some of the things, but kind of fun. So that's the 10-stepper. We already figured out this patient had cardiac arrest because she had prolonged QT. Now, I want to bring you back to where we started on the first night when we started our journey together 2 weeks ago. Now this is quite a long time that we would spend together already. So I hope that we all feel like we know each other by now. And we dipped our toes in the waves and the rhythms and the intervals. We even did a little recap of that tonight. We didn't really get to talk too much about the 12 lead. We briefly touched on it, but that's the next step we would want to use to get comfortable. We didn't talk too much about what a normal EKG is. There's actually a lot to it, but we went over the basics. We talked a little bit about coronary anatomy. I showed you the model. We mentioned and briefly touched on high-risk patterns. We talked about them. We didn't really go over many of them because we didn't have time. We've already spent this is our 5th hour, I think, together, which is a lot. And then we talked a little bit about STEMI criteria, but we didn't really do any STEMIs. We didn't really talk about any subtle STEMI. We didn't talk about the mimics, but this is kind of like where we started. We want to get you to here. So there's still more things to learn, right? There's still this extra pathway here on how to get you comfortable and confident. So if you liked the lectures and you want to continue learning with us and not go it alone, or you go try to find all the information on your own and figure it out with nobody to help you, then that's where we come in. Now, as you've seen, we have a lot of people from our 30-day EKG challenge, KJ and Matt, or it, right? And we're all here who are in the chat encouraging you. I didn't ask them to do that. They do it because they want you guys to feel the love and to feel supported, because that's how we are in our group. We want everybody to be safe providers. So that's how it is. Even the people that are in our 30-day, Christy is in our 30-day, they come to these classes that we do in your main group here because there's still a lot of good stuff, right? It never hurts to review. And that's the thing. If you don't review, you can easily lose it. So it's starting tomorrow, our 30-day EKG challenge. And what's super awesome is that you also, the next two people, I saw two spots, the next two people who sign up tonight will actually get one of those mini coaching sessions with me. So I did one right before we hopped on our call, and I got to tell you, it was so fun. I was like, what do you want to talk about? What do you need? And we just talked about it and got her like feeling a little more confident. And so I love doing that. I've never done that as part of the 30-day before, but the next two people to join will have access to that. So getting back to the schedule. The schedule is going to be tomorrow. We're going to do welcome call and more EKG terms. We're going to have a little handout that goes with this. Then on Wednesday, we're going to do arrhythmias where we practice. And then also we have two classes on Thursday. And everything, by the way, let me just go back. Everything is optional. The only thing, if you're going for CE, that you need is in the learning portal. Okay, the CE classes are in the learning portal. There's 14 hours of category 1 CE for medics, nurses, PAs, NPs. Those are all in our learning portal. But everything else is just gravy. Now, you actually can use this as sort of a choose your own adventure. Like, let's just say, like, one of the people that Joyce just joined, she's going to start a new job on July 1st. And she is going to be a new cardiology provider. And so I walked her through like, hey, here's how to choose your own adventure, right? Well, she already knows this stuff. So I showed her in the group, okay, you're going to need to know AFib, hypertension, stress testing, and cardiac pharm, right? Let's talk about where to find those lectures in our group, because we've got lectures for the past 3 years pretty much on everything. I told her, hey, look at this echo one, look at this Holter one, how to answer triage messages. Like I showed her, these are the things you want to beef up on. And I showed her how to find them in our group. And then we kind of talked about a little bit of antiarrhythmic stuff, a little bit of anticoagulation stuff, and we had a good time. But let's just say you're a medic and you're like, I don't need to know any of that stuff. I just want to get good on EKGs. Well, then you go to all the EKG stuff. And if anything else also is interesting to you, you can come. But this is going to look different for everybody. So we try to make a lot of variety. So for example, where we have the hemodynamics. This is a very special lecture that we haven't had before in our session. This is a critical care RN who's going to come in and do this. It's actually Matt Holden's wife. She's going to do this lecture for us that I saw samples of the slides tonight. I was like, I can't wait. Is it Thursday yet? And so anyway, getting super excited about that. And then the study hall that David has. So that's an interesting thing because people can submit their EKGs and he'll go over them for you. And that's super fun. So Beach, what times? Oh, yes, good question. So they're all Pacific Standard. So what time zone are you in, Beach? And if you work, they're recorded. So that's no problem. And we actually have people in Australia. We have one person who's in Australia. And so it's a little, and you'd be interested, but you're in Canada. Oh, Canada. So then what time zone are you on? If you're in Canada, Central. Oh yeah, totally. So then you would just add on 2 hours to anything. So like this would be 6 o'clock, this would be 4 o'clock, 6 o'clock. And so you can totally make it. Yeah, you can totally make it. And then, so you can submit EKGs to David and he'll go over them for you. He also sometimes does themes, like he's done topics like how to tell VTAC apart from SVT. He's done like all the advanced topics that you could want and dream of. He's done them already. We could refer you to them. Then we're going to I send you in this box when you sign up. Here's my box. I painted this cover, by the way. And I send you a workbook. And we go through it. We're going to go through it on the 18th together. Look at that. It's got a bunch of real EKGs in here. While we're on the topic, I also included in this box a little present for you. This tool that you could use to look at the ST segment elevation or depression. I also send you my patented cheat sheet that tells you about Axis and the 5 things that you want to look for on every EKG. That's in here. There's also a normal EKG that we're going to use with our crayons to basically carve up. You get crayons with the colors I need you to have. I know the ArtCat window is very helpful. And we color code the EKG. Yeah, we color code the EKG. And then we also are throwing in for this round only Matt Holden's Semi-Mimics badge. You're going to get that in your box. Oh, and also a little instructions on how to use the window tool. There's a little instruction sheet because that's a gift from us. And then you also get a little mini part. So you can see I paint all of these. They're all custom. You'll have your own artwork. I'm actually most likely going to be a featured artist in the UK in September. Yeah, you should totally come, Beach. It's amazing. But I am actually, I've been featured in San Francisco in a major art show, and then I'm going to be in the UK. So getting one, I used to say to people, oh yeah, you want this because one day I'm going to be famous, but these might be worth something someday. So hang on to them, guys. Hang on to them. Yeah, the UK, it's actually a sudden cardiac arrest art exhibit. So I have to make the piece still. I'm getting so inspired making it. But anyway, back to the task. So then we're going to do basic 12 lead practice. We're going to do arrhythmia practice. I'm going to throw in some inpatient cardiology cases. And Joanna, it's not important to make the lives. It's actually not. You could literally go to none of them and watch them all recorded and you'd have the info. Now, here's the other thing. So let's just say you're like someone who's going to work all these days and you can't make any of them. And you're really have like these burning questions. You can put them in the group and then we'll answer them live for you and you can watch the recording later. So we do that also where like if somebody is like, I really want to know, like one of our students that joined, she was like, I really need help on how to write a SOAP note. So we made her a class on SOAP note and did it for the whole group. There was someone who's like, I really need some practice on heart failure cases. So we got a heart failure NP to come in and do cases. Somebody was like, I really need cardiac farm. So we did cardiac farm. Like it's basically, this is a space where you get to help us co-create if you want to see something. Now we have stuff, it always changes. We always have new stuff. So you're in for 6 months with us. So Beach and Joanna. And I'm going to show you the group and how to navigate it really quick so you can see what's in there. There's tons of stuff in the group that's already done. For example, there's a thing on stress testing, right? You can go back and watch multiple lectures on stress testing. Like how do you choose a test? How do you work up a chest pain? What do I think of with chest pain? Like, what are the EKG findings I should be concerned about? Like all those things. And then we're going to do an AFib update because we did a little vote in our group and people said, hey, we want some guidelines updates. So we're going to have that on the 25th. And then we also have the sleep apnea queen. Yes, we have her doing a ton of lectures as well in the past. And then this is going to be putting it all together. So we'll practice and then we keep going. Every month there's new stuff. I'm putting together the July schedule right now. So what we do is we release it once we get it. And the classes are not going to be on the weekends. So that's good. They're going to be during the week. And you can say like if you join, you can say, hey, I really want to see something on beta blockers, for example, or so one person said they wanted to see something on sick sinus syndrome. So like you name it and we create it. It's like Burger King your own way. We also have EP coaches we have stuff on devices. We have stuff on med math, like pretty much anything you want. We have something on valves. It's there. So that's me and Michelle, Coach Michelle. She does a lot of visual stuff for us in our class. She's going to be doing some more stuff in July that's very visual for us again, just to kind of keep us refreshing on the basics. And then here's just a little sample of some of the classes that are in our library, I guess you could say, that you can access immediately once you get in. And there, if you go to the Beach page, let me see if I can stop my share so I can show you the Beach. Let me see if I have the Beach. So remember that Beach page that I put together, you guys? Let's see. No, that's not it. There, let me see if another window has it. There it is. Okay, I got to share this one. So there's actually a brochure at the Beach. And I don't think anybody found it. So you guys can see my screen, hopefully, still. Yeah. All right. I think you guys can see it. Let me see. Okay, yes, there's actually some stuff on the beach. So this is our last night together. I wanted to now reveal all the things in the beach. So this will be up till the end of the week too. So if you guys want to explore the beach. So this is actually right here. This is the catalog, okay, that's in that little brochure. So this is all the things that we've done, and it's listed by instructor that you could go through. And the one you're going to get inside the Facebook group when you join has a link to the class. So for example, like let's say you want to watch the cardiac murmur lecture, there's going to be a link in our group that'll take you right to the lecture. What's hot, what's not in cardiology, you can watch that one, right? There's think like a pacemaker, chest pain guidelines update, PVC localization, like long haul COVID. Michelle does a bunch of classes as well, vasoactive drugs, basic EKG, Coach Megan, if you're into like becoming a cardiology provider, this is where you want to spend a lot of your time with Megan. She's got a ton of stuff in here. She's our cardio queen. We love her. She even did a pre-op risk thing, how to read a Holter, how to read an echo, how to answer triage messages. This is our sleep queen. She's got a ton of classes. She has CPAP. She's got pulmonary hypertension, which honestly is a really great lecture. Sleep apnea, how do you make the diagnosis? How to interpret PFTs. David, he's got, I couldn't even list them all, but here's some of them that he has, and I linked them. But like how to read an EKG through a pacemaker, bundle branch class with examples, AV block review, Brugada's J-point LAD lesions, OMI, he talks a lot about that, lethal arrhythmias, lead misplacement, QRS fragmentation, U waves. I mean, he just goes on and on. And then here's Coach Sean. He's going to be teaching for us on Wednesday, the arrhythmias, but he does a lot of rhythm practice for us. There's tons of heart block stuff. There's even a 1.5-hour ACLS prep course in there. And then this was our lipid queen. She talks about basic lipid testing, advanced lipid, and then also lipid clinic tips, like how to get your meds covered. She talks about all the new agents. Then this is our EPPA, Kim. Oh my God, such a rock star. She talks a lot about devices, anticoagulation, antiarrhythmics, and stroke prevention. She talks about the Watchman, the Amplatzer, all the things. This one is Camille. She actually talks about like kind of a potpourri of things. She does a cardiology if you're an on-call, how do you manage the triaging for that? She does a left heart cath game. She talks about left heart versus right heart cath. And then she also does PAD. So that's just some of the classes in here. And then let's see if there's any questions in the chat. If there is lifetime access to the lectures that are in the portal, actually. There's 14 hours of classes in the portal. And there is a way to get lifetime access to our 30-day ones in the Facebook group. That's the ones we showed you there. We basically, after you complete your 6 months in our group, we extend you that offer to stay with us for a lifetime or a year, and super reasonable pricing, actually. The other thing I wanted to show you is our Facebook group. I'm going to go to our different window. So I want to show you kind of like what it looks like. Oh, here it is. Okay, I got to share that with you. I want to give you just an example of what it looks like inside there. So I think it's this one. Okay, so here's our group. And so like, let me go back. All right, so here's our 30-day EKG group. Okay. It's a very intimate group, very family, we're a family. Let's leave it at that. So this is the main area. So this is that little PDF I showed you with the links. It takes you right to the class that you want to see. We put all the events as we schedule them in the events tab. So you can see they're already here, and you'll just click into them and you'll click on the Zoom to go to the class, or you can just watch in the Facebook group there. And you can also add them to your calendar. You can say add to calendar and put all of these on your calendar so then you don't forget. You can also click going, and it'll send you a reminder that day that you need to go. So that's kind of fun. And then we store all the lectures when they're done. We store them in the month. So like You've got some in May, you've got some in April, and basically I didn't even put this on there. This isn't even on our handout yet, but hypertension cases. I just did a full thing on hypertension, how to manage that. And then we even have a resistant hypertension lecture that my partner, Erin Lee, did. In here, we have arrhythmias, heart blocks. What else? There's so much. This is like 3 years of stuff. You could go through and be like, what do I want to watch? Oh, ACLS scenarios? Okay, cool. Ooh, scenarios with Jen. What would I do? Long haul COVID with Aaron. Think like a pacemaker with Sean, where he talks all about pacemakers. This one is a really good one. Chief complaints, how to work them up. I really, really think that's valuable, especially if you're well in cardiology, but anywhere. And here's, Whitney's one of her advanced classes. This is an update on the literature. These two are updates on both chest pain and then heart failure, mostly with our professionals. So like it just goes on and on and on. And then there's a ton of stuff in the files just to show you guys right here. The files are, if we ever have a PDF, like David always puts his PDFs of his study halls. We also have, everything we've ever done is in here. There's even an epic dot phrase thing you can steal that I put together. But like SOAP notes, here's the SOAP notes one that we did that student asked us for. So, and you can see this is just going on and on and on and on and on. Here's the dot phrases one. So, there's a ton of stuff in here. Like literally, you just can't ever probably watch it all. But anyway, yes, there is lifetime. So let me go back in and tell you the pricing so you know that. And we'll go on. So you get 14 hours of category 1 CE, you get everything in the kit. The next 2 people who sign up will actually get a 30-day or 30-minute coaching session with me, private, you, me, one-on-one. As a bonus, we don't ever do this, but we're doing it this time. And you get the workbook and you get an extra badge because you actually get Matt's STEMI badge, STEMI equivalent badge, which is he's actually out of right now. And then you get access to 2 groups, not only to our 30-day, but also what's called our Launchpad group. So actually it's 2 groups of things you have access to. And the Launchpad is where we do every Wednesday night class because it's just the basics. So students can get in for $149. You still get the box and you just don't get into CE because you don't need it. But if you're someone who doesn't need CE, you've been doing this for 6 months, this rate is like crazy good. EMS, RN, and NPPA. The link to get in, let me see if Ruben's still around. Ebony, oh my God, you signed up. That means you get your half-an-hour tutoring with me. So excited, Ebony. I've been seeing you around and wondering when you were going to join us. And thank you for joining us. If Ruben could post the link, let me see. Oh, he's putting it in our Facebook group. He'll put it here in Zoom. But I just want to know if you guys have any questions or any comments or anything else that you would like to ask while you have me here. There's the link. Ruben just popped it in our Facebook. Beach is going to sign up. Whoop, whoop. Beach, you got to tell me what part of Canada you're coming from when you get home from kiddo soccer. Okay, awesome, Beach. And tell me, I want to hear more about you when you get in. I want to hear about like other things we can do to serve you. Like, for example, are you a new cardio provider? Are you in primary care? Like, where are you coming from? And if you want any bonus classes, let us know. I'm so excited. But any other questions about anything we covered or anything that you've been burning to ask but didn't have anybody to listen? Let me know. Otherwise, I'm going to get to putting together your kits for the people who just signed up so I can pop them in the mail in the morning. And yeah, I think that's it. All right. If there's no questions, it's been so fun. The replay page I'll post so you guys can watch these sessions throughout the week if you want to refresh. But if you join the 30-day, you're going to get lifetime access to the recordings. So that's going to be good. And they'll be in your portal. Yeah. So thank you for coming. Thank you, Matt. Thank you, KJ. Thank you, everybody who's been participating. I know that if you've gone to every session with us, it's a lot. And KJ, you've been at everyone. You too, Matt. And I so appreciate you guys for helping me with questions in the comments as well. And Dana, what's up? So excited. But we'll see you inside the 30-day. Looks like Kathleen is here. Yay! And if you have any other questions that we didn't answer here, just reach out to me. Joanna, I hope to see you on the inside. And Beach and Ebony and everybody else who's joining us. And we're going to kick it off tomorrow at 5:30 PST and get to know you a little bit better and spend some time. And I can't wait to do the one-on-one tutoring sessions with you guys. So excited. All right. Bye.